Hello and thank you for watching. I'm here today with board-certified pediatrician Carey Venglarcik, MD. Dr. Carey will be answering the questions about childhood immunization that you submitted recently via Facebook Messenger. Dr. Carey is a board-certified pediatrician at Shasta Community Health Center. She graduated from Creighton University Medical School in Omaha, Nebraska, and completed her pediatric residency at Kaiser Permanente in Oakland, California. She has been an outpatient pediatrician for 6 years. Dr. Carey, thanks for joining us today.
Thanks, Ross. I'm really glad to be here and have this conversation with our community about this topic that I feel very strongly about.
So tell us, Dr. Carey, why is this topic so important to you?
As a pediatrician, my main goal is to keep your children safe and healthy. Vaccinations are one of, if not the best tool that we have to achieve this. I don't want to see the children of our community suffer or die from diseases that can be easily prevented. For example, in the late 1970s, there were 20,000 cases of Haemophilus influenza, also known as Hib, brain and joint infections per year in the United States. Now, there are less than 200 cases per year, thanks to immunizations. Think about it. When was the last time you heard about a child suffering from polio, tetanus, smallpox, diphtheria? You probably haven't. And that's because parents over the last 30 years have chosen to vaccinate. The risk of kids being hospitalized with or dying from vaccine-preventable infections has never been lower.
So what's changed?
Unfortunately, the internet is full of myths and misinformation about vaccines. Parents want to do what's best for their children, but it's hard to separate fact from fiction. The myths have created fears and concerns among parents, and as a result, the number of children who have been vaccinated has decreased. And that means more of our children are at greater risk of contracting a serious infectious disease.
That's very concerning.
It is.
Well, thanks to all of you who submitted questions. There are questions about vaccine risks, side effects, and safety, vaccine ingredients, the vaccination schedule, and more. Dr. Carey, are you ready?
Of course.
Our first question is from Jessica. Jessica asks, why are vaccinations so important? Dr. Carey?
Without vaccinations, millions of people will suffer or die unnecessarily. Before vaccines, infant mortality rates were much higher. Back then, it wasn't unusual for families to lose a child in the first few years of life due to an infectious disease. Even 30 years ago, devastating, horrible things happened at much higher rates due to diseases that are now prevented by vaccines. As I mentioned earlier, in the late 1970s, there were 20,000 cases of Hib brain and joint infections per year in the United States. Now there are less than 200 cases per year. Did you know that Hib brain infections were among the most common causes of deafness? Because of the vaccine that has led to a dramatic reduction in Hib infections, less children have hearing loss. You just don't hear about infants and children suffering from whooping cough, measles, polio, tetanus, Hib, pneumococcal blood and brain infections, or rotavirus, amongst other things anymore. But we don't have to look far into the past to see how widespread and dangerous and deadly these now preventable diseases and infections can be.
Connie asks, I would like to know why manufacturers and healthcare professionals are not held liable when there are astronomical rates of vaccine injury and death. Dr. Carey?
Significant vaccine side effects are quite rare, estimated to be about 1 in a million doses. In my practice, I am happy to say I have rarely seen an adverse reaction to vaccines. In those rare instances, I have seen allergic reactions, febrile seizures, which are scary yet harmless, benign rashes, and localized reactions. And most pediatricians I know have the same experience. The National Childhood Vaccine Injury Compensation Act was put into place to protect pediatricians from frivolous lawsuits. And these frivolous lawsuits were decreasing the pediatricians' use of vaccines. What I can say is that there is no question about the potential harm that can come from diseases and infections that are now preventable. If we do not immunize ourselves against them, the consequences would be devastating. The number of hospitalizations, serious complications, deaths, and these diseases would skyrocket. It's a matter of the greater good, and the good that comes from preventing these diseases far outweighs the risk of vaccine-related adverse reactions.
Thank you for the question, Connie. Multiple people asked why there are so many vaccines given to children at such a young age. These folks are concerned that it's too much for a child's immune system to handle Dr. Carey, how would you respond to that?
It's a myth that the newborn's immune system is weak. During pregnancy, some of the immunity that the mother has, but not all, is passed to the child. Some immunity that she's achieved thanks to vaccines. From the moment the child is born, they are exposed to many different bacteria, viruses, and germs on a daily basis, and the immune system is perfectly capable of handling this. But from the age of 0 to 2 years of life, there is a weak spot that the body is not able to protect itself against from certain bacteria. Vaccines are made to fill in this gap and strengthen the immune system without having the child suffer from the consequences of actually getting the disease.
Some parents stated that they would prefer to vaccinate their children when they are older. Dr. Carey, what would you say to those parents?
I know you want to do what's best for your children. Please consider that from age 0 to 2, there are gaps in their immunity that vaccines are designed to fill. By waiting, your child is actually at greater risk of contracting a serious or life-threatening infection.
Well, then what about spacing out the series of vaccinations a little bit more?
Great question. It is so important to vaccinate your child on the prescribed intervals because vaccines don't provide the same efficiency of immunity that your body does naturally. So they need to be boosted at prescribed intervals to ensure your child's immune system develops the strongest possible response for maximum protection. The other thing to think about is that by spacing them out, you are actually subjecting your baby to several more injections than he or she would normally receive. No one likes getting a shot, and afterwards your son or daughter could be fussy, sore, or run a fever for a day or so. And there's just no scientific benefit to spacing out vaccine series.
Cassidy asks a slightly different question on this topic. How much do doctors get paid for fully vaccinating a child?
Doctors don't make money on vaccines. Most clinics are lucky to break even on immunizations. Sometimes a clinic will charge for an office visit if a parent chooses to space out vaccinations outside of the recommended schedule during well visits. In a sense, spacing out vaccines over more office visits may result in clinics being paid more as a result. But again, there is no benefit to spacing out vaccines.
But what about getting several vaccines at once? Isn't that hard on their little systems?
There's no scientific data to show that getting several vaccines at once causes chronic health problems.
Okay, but why are there more vaccines given now than ever before?
Progress. Medical research has enabled us to develop new vaccines to protect against other dangerous diseases.
Now let's talk about the ingredients in vaccines. There seems to be some debate about what is actually in them and whether they are safe. Shirley, Connie, and others specifically asked about these ingredients: aluminum, antifreeze, animal parts, baby parts, formaldehyde, mercury, and thimerosal. Dr. Carey, what can you tell us about these ingredients?
What I have to say may surprise you. Let's start with aluminum. Aluminum is used as an adjuvant. An adjuvant is added to a vaccine to boost the person's immune response to produce more antibodies and longer lasting immunity. It minimizes the amount of antigen, or the thing that's needed to make the immune response, that's added to the vaccine. With it, the immune response is stronger and fewer doses of the vaccine are needed. Aluminum is found in many things like food, water, even breast milk. Within the first 6 months of life, an infant will consume about 7 milligrams of aluminum through breast milk. Within the same vaccines given during that time on the recommended schedule, the baby will be exposed to about 4.4 milligrams of aluminum. The amount of aluminum in vaccines is so minimal that there's not even a detectable rise in the bloodstream immediately after vaccinations are given.
Wow, that's interesting. I didn't realize that. Connie mentions research by Dr. Exley and Dr. Hooker about the danger of aluminum. Are these findings legitimate?
Some refer to studies such as these as pseudoscience. They present themselves in a way that most scientists do with data and formal studies, but they are poorly constructed, riddled with flaws and bias to fit an agenda. That is why it's so important to rely on reputable sources like the Journal of Pediatrics published by the New England Journal of Medicine, the Lancet, the CDC, the National Institute of Health, and PubMed, amongst others. To be published, studies must pass through rigorous peer review processes to ensure that they are properly constructed and free of bias.
Wow, that's interesting. Now, what about antifreeze?
Vaccines do not contain antifreeze, nor do they contain animal parts.
Is it true that baby parts or cells are used as an ingredient in vaccines?
More than 40 years ago, fetal cells were used to culture viruses during the manufacturing process. Fetal cells are not present in vaccines.
Now, what about formaldehyde? Isn't that a carcinogen?
Formaldehyde is used to inactivate viruses and detoxify bacterial toxins to ensure they don't cause sickness when they are injected. Formaldehyde is always present in the human body and an important part of the metabolic process. It is a carcinogen, but the risk only occurs with long-term exposure to large amounts. The amount of formaldehyde in a vaccine is very small. About 1.1 milligrams of formaldehyde is naturally present in a 2-year-old's body, while the highest amount of formaldehyde in any vaccine is 0.02 milligrams per dose, about 50 to 70 times less. Did you know formaldehyde naturally occurs in pears, apples, onions, potatoes, fish, and beef? For comparison purposes, the average size pear contains about 12 milligrams of formaldehyde.
I've heard a lot about mercury and thimerosal. Can you tell me about them?
There is no mercury in vaccines, but it is easy to see why people mistakenly believe vaccines contain mercury. The chemical name for mercury is methyl mercury, while the chemical name for thimerosal is ethyl mercury. Although chemically similar, they are different. Ethyl mercury, or thimerosal, is used as a preservative and is used for preventing dangerous bacterial or fungal contamination of vaccines. There's no scientific evidence that thimerosal has any harmful effects, including autism. Nonetheless, as of 1999, public health agencies and manufacturers of vaccines agreed to stop using thimerosal as a precautionary measure. Today, it is only found in certain influenza vaccines for adults, but is not in any vaccines given to children.
Now, speaking of vaccines and autism, several people inquired about this. Do vaccines cause autism?
There is no association with autism and vaccines. At this point, enough scientific evidence exists that no longer is there a question or debate. The issue relates to association and causation. Children receive many vaccines between birth and age 2. At any given time, there will be a certain percentage of children who are diagnosed with a disease, like autism, that got a vaccine in close proximity to their diagnosis. But that doesn't mean that the vaccine caused autism. It simply means that the administration of the vaccine and the autism diagnosis occurred close together.
So what you're saying is that just because one thing, the vaccine, happens before a second thing, the diagnosis, it doesn't necessarily mean the first thing caused the second thing.
Exactly. Think of it this way. If you tripped while walking down the sidewalk and you were trying to figure out why, you'd likely think back to what happened right before you tripped. You realize that a friend brought you coffee earlier that morning, and maybe that's not something that happens very often. Or maybe it hasn't happened at all. You think it's because of the coffee your friend brought you why you tripped. Then, when you talk to other people, and a few also received coffee by friends shortly before they tripped, it starts looking that the coffee was the reason why you tripped, when in reality, you tripped because there was a crack, uneven section of sidewalk. When bad things happen, we naturally look for a cause other than random chance or luck. Since kids frequently receive vaccines between birth and age 2, and conditions such as autism are often first diagnosed in that same age range, it can seem like the vaccines are the cause.
Interesting analogy, I like that. Cassidy would like to know what you think about a recent study correlating SIDS and vaccines. She says, now that a lot of babies aren't going to doctors, the death rate among infants has dropped drastically. What do you have to say about that?
Thanks for your question, Cassidy. I'm not sure which study you're referencing exactly, but the study I'm familiar with is from Human and Experimental Toxicology from 2011. While there have been some reports and concerns over the years about SIDS and vaccines, this one study, and I suspect any other study, has many flaws and confounding factors, most of which the study itself calls out. Specifically one, the definition of infant death in different countries is different. So countries' numbers for infant mortality rates are lower, not because there's actually a difference in deaths, but because the numbers they are reporting have different definitions. Our country does have a higher infant mortality rate, and this is thought to be one contributing factor. The United States also has more preterm births as well, which increases the risks of death within the first year of life. Infant mortality rates are not differentiated between whether the child is vaccinated or unvaccinated. The rate of SIDS in vaccinated and unvaccinated children is the same, so we know that there's no correlation. Also, the rates of sudden unexplained infant death over the last 5 to 10 years have been relatively stable, but the rates of vaccinations have been decreasing. If there truly was a correlation between vaccinations and SIDS, we should be seeing a decrease in rates of sudden unexplained infant death, and we aren't.
Okay, Dr. Carey, let's shift to the topic of how vaccines are studied and monitored for safety. Jessica asks, which vaccines have been tested to see if they cause cancer?
Hi, Jessica. Developing a safe and effective vaccine is very difficult and time-consuming. The process of studying these vaccines is stringent with multiple phases and trials, with increasingly larger number of animals and people participating. Through each phase and trial, there is a constant monitoring and reporting for serious side effects. Cancer is one side effect that they look for. All vaccines are studied for safety independently, along with the current vaccine schedule and in different combinations prior to being approved and placed on the recommended vaccination schedule. If there is any indication that cancer is a side effect, a vaccine would not be approved. It's unethical to continue to approve or continue to recommend a vaccine if there have been significant scientifically proven side effects like cancer or other serious diseases. If an association is discovered with a vaccine and a serious side effect, a vaccine is reformulated, or if it is already approved, it is removed from the recommended vaccine schedule until a new vaccine is manufactured and studied.
Would you mind providing us with some examples?
Yeah. The live polio vaccine works far better than the inactivated one, but a certain subset of people actually got polio from it. Even though it works a lot better, we don't give the live vaccine anymore because of the risk associated. Another example is the rotavirus vaccine. When it first came out, some concerns were presented for a possible intestinal complication. It was removed from the recommended vaccine schedule, and another vaccine that was just as effective that removed the risk was produced. First, do no harm. That is the first line of the Hippocratic Oath that we take in medicine.
Jessica would also like to know which vaccines have been double-blind placebo tested.
It's a good question. Those are the best types of studies, but no vaccines have been through a double-blind placebo-controlled testing, and it would be unethical to do so. To perform a double-blind placebo-controlled test, a group of young children would need to be exposed to a disease that is potentially lethal. Some in this group would receive the vaccine, while others would receive a placebo, or basically nothing. To expose a certain set of children to a lethal disease without providing them protection is immoral.
So Dr. Carey, who is watching over these vaccines to make sure they're safe, and how are side effects discovered?
The Vaccine Adverse Event Reporting System, also known as VAERS, is a national safety program sponsored by the FDA and the CDC. The Clinical Safety Administration Project is a partnership between the CDC and many medical centers. There's also the Vaccine Safety Data Link and Post-Licensure Rapid Immunization Safety Monitoring that are two reporting systems that collaborate between the CDC and several organizations. Basically, there are all these different systems and programs in place that provide high-quality vaccine safety research.
Now let's answer some questions about specific vaccines and scenarios. First is a question about the hepatitis B vaccine. Why is it given on the very first day of life, even if the baby's mother is tested negative?
The hepatitis B shot is routinely given on the first day of life for two reasons. The first reason is that in the past, when the vaccine was only given to those at risk, there was really not a significant decrease in cases. And two, if the infant contracts hepatitis B at birth, he or she is at a much higher risk of liver cancer later in life, and there is no cure for hepatitis B. While the risk of contracting hepatitis B at birth is actually quite low, the long-term risk of liver cancer, if they do, is very high.
A comment from Hannah reads, I was told by a doctor there were no side effects to the vitamin K shot given to newborns, when in fact, there is a documented risk of death. I wish the doctor would read the manufacturer's vaccine inserts before answering questions.
There is no documented risk of death with vitamin K shot. However, there is a risk of death from having a serious bleed associated with not getting the vitamin K shot. Also, regarding the manufacturer's inserts, I do read them, and they can be scary. Some of the reported side effects are intimidating, but the thing you have to remember is that this is a legal document. It is not a medical document. The pharmaceutical companies are required to list any reported adverse events, regardless of whether they are correlated to the vaccine or not.
Jawanda asks, my great-grandson has turned 1 this year. He has been pulling on his ear and crying sometimes, almost every day. He had 2 ear infections when his mother took him in. They gave him antibiotics. He took it but still pulls at that one ear. He has an appointment to get his 1-year shots. Should he still get them?
I get this question a lot. It is safe and still recommended to get vaccines even with a mild illness or fever. Only if a child is seriously ill or hospitalized should he or she not get vaccines.
Sharon asks, what if a baby got too many polio shots? My son got 5 in 1 day. I think it was too many.
I have a hard time imagining that any clinic or hospital would give 5 polio vaccines in 1 day, but assuming it did happen, getting too many doses of a vaccine is generally not harmful. It's more about the spacing of the vaccine, and giving them too close together could result in a larger localized reaction like that which is known in DTaP, especially with the 4th and 5th doses in a series, or with the pneumococcal vaccine. But this is not serious, just unpleasant.
Well, this has been quite the conversation. Lots of great questions and information. Dr. Carey, any final thoughts?
Thanks to everyone who submitted questions, and thanks to all of you watching now.
Thank you, Dr. Carey, and thanks to each of you who participated today. If you'd like to get the facts about childhood immunization, go to ShastaVaxFacts.com. Be well.